MilfordMD, Richard Buckley, and the posse, Amy, Gabriella. We are almost done with ultrasounding, that is vasering the abdomen. I'll do a little more up here in a minute, but I wanted to start with some of the liposuction to show you that. This is fat. It's fat that's been bounced off of where it was stuck, and I'm suctioning it out here. If I don't move, and I'm not moving right now, talking to you, then you can see there's no fat flying in here. But if I turn on the vibration, which isn't moving very much, it's vibrating in place just to help things go along smoothly, still no fat flowing in here. Amy, you want to hold that for me? Yeah. So if you watch right there, as I begin to move, I expect that it's going to, start moving. Right? See how the fat is just flowing out in that tube. Patient awake, totally comfortable, and the fat is flying out. We're going to fill up a couple of buckets worth of fat. Fat cells after puberty are not made anymore. You could get them bigger or smaller, or you could get them gone. So in this case, we're doing body contouring, body sculpting. You could say liposuction, it's true. We're also going to do tucking of the skin. So any tummy tuck, abdominoplasty, most of the time it's, unless people are really skinny, most of the time it starts with lipoing, so lipo sculpting, followed immediately by taking the skin off, from here down to there and getting that together. First I'm going to get the fat out of the way. So this is the liposuctioning part of this morning's extended lipo abdominoplasty. Extended means we're actually continuing the incision over onto the waist here. You can only reasonably and ultra safely get so much done at a time. We worked on our patient's other side last week, and you can see there's even a little tiny bit of bruising there on the waist. That's from us working on the hips and the waist, lower back last week. And today we're doing the front side to finish things off. See the fat flying? And when I wasn't moving, it wasn't flying. And you might think that, well, that's the important end. And usually there wouldn't be these little pieces here for just simply doing lipo. Those are there to protect from the Vaser. I showed you that. But if I move, then there's stuff happening. Once again, this is my smart hand. It acts as a backstop, so you can see there's a cannula there. And so if I don't want it to go somewhere, it's a backstop. Plus I feel it. I always work between my fingers. Maybe just a slight little squeeze of the skin. And the cannula, if you look at this, we'll gauge that distance right there, just a little bit, right? So I'm going to put my hand right there where that is. I'm going to take this out. You can hear the suction, and I'm going to put that kind of roughly where it was. And you can see that tip was between my fingers. If I put this in straight to there, that's where I am. Or that's where I am. Or that's where I am. Or that's where I am. And this is blunt, not sharp. And I'm not being rough. These come in all different sizes. This is actually a very delicate, nice one. You like being delicate, nice. And you can see the fat is just continuing to fly out. And we have the rest of the abdomen to suction down. Thank you for watching another episode of MilfordMD and with the posse.